when you work in public service for 25 years, you pretty much see it all, as Michael Nutter has. But the mayor says that what happened to Danielle Kelly was one of the most tragic things he has ever seen. Certainly, it is one of the most tragic that we've seen here on It's Your Call. Kevin Walsh, thank you very much for that report. Joining us now to discuss this story is Anne Marie Ambrose. She is the commissioner of the Philadelphia Department of Human Services. She joined this position only a short time ago on June 23rd of this year, and she is now in charge of changing the image and the services provided to the public by this department. Commissioner, thank you for joining us this hour.
Thank you for having me.
You heard Mayor Nutter say that this was the most tragic thing he had seen in 25 years of public service. Describe for us what this case has been like for you.
The case has been devastating for me and for the department. I think part of the tragedy here is that there's no excuses being offered by the department at this time. What we're trying to do is acknowledge the good workers that are at the Department of Human Services and move forward with the reform agenda that has been identified since the Danielle Kelly death occurred over 2 years ago. And so really what we've been trying to emphasize is that the DHS of 2006 is very different from the DHS of 2008. We feel good about the direction we're headed in, and we really want to resolve the issues surrounding the grand jury investigation, take those recommendations, and move this agency forward in the right direction for kids and families in Philadelphia.
I do want to talk about the reform efforts, and we'll do that later in the program, and also talk about the hard work of so many caseworkers, not only in Philadelphia, but all over the country. There are so many who are trying to do what's best for young kids. But in this case, which is the first topic of discussion here on the show, it seems like not only did her parents fail her, but so many different layers of the Department of Human Services failed her. How could that happen?
I can't explain how it would happen. I acknowledge the fact that this was a huge systemic failure on many, many levels. I have no excuses and can't explain the actions of some of the workers involved in the case. There were many workers involved in the case who did do the right thing, though, and those workers are also mentioned in the grand jury investigation.
Let's start with the pictures we're looking at now. She seemed like, even though she had had a disability, that she was getting the care that a child needed when she lived with her father. Can you explain for us the circumstances that changed her living arrangement?
I'm not sure exactly what the circumstances were. I haven't had the benefit of reading the entire file, and those instances aren't spelled out in the grand jury investigation report. I can tell you that based on what we learned from the Danielle Kelly death, we've increased the number of nurses that we now have at DHS to try to provide guidance and assistance to caseworkers who have special needs children with medical needs. And so those workers are on site with the nurses, gathering information that's necessary. It's a pretty easy conclusion to come to that had we put Danielle in school like she was supposed to be put in school, taken her to the doctor the way she should have been taken to the doctor, given her special medical needs, and followed through with cerebral palsy, United Cerebral Palsy, and done some additional research and made some outreach, things would have been very different.
Now, sadly, what we're told from the investigation from the Philadelphia Inquirer and then what's included in that grand jury report, when she was changed, when her living arrangements changed and she started to live with her mother, apparently the authorities are alleging that her mother did not want to care for her or could not care for her or was somehow revolted by the idea of having a child with cerebral palsy.
I think there were many instances in her early life when she was well taken care of. There was somebody who was interested in getting her up on a daily basis, getting her to school when she went to school. I can't explain why the number of people, including her mother, who entered into that home didn't do something more. There were many people, and you know, one of the things that we emphasize at DHS is that this is really a community effort. When you notice something that you think is wrong in a family or a home, it doesn't hurt to call and offer assistance and, you know, try to reach out and be a good neighbor. And so there were many people who I think, you know, just on a community level who had the opportunity to intervene and didn't.
And yet there were people who brought this situation to DHS attention, and that's where the system broke down, to use your own words, that there was systematic failure. You know, we can't grasp as just the general public why parents would allow something like this to happen. But then it's even more confusing to us that not one, not two, but 7 or 8 other caseworkers, and perhaps dozens more, were somewhat aware of this and didn't take steps to help her. And I know that there are many good people who came forward and did try to help her, but how can we explain why these people who were in the business to save this child look the other way?
I have no explanation for that. I mean, there were clearly 2 DHS workers who failed to provide the services that that family needed and that Danielle especially needed. Also, some agency social workers who didn't do what they were responsible for doing for Danielle. There were, however, 2 DHS workers who went out and did the right thing, did an investigation. One of our workers, mentioned in the grand jury investigation report, went out not once, not twice, but 3 times. The problem was when she passed the case off, the case fell through the cracks and we didn't do what we were supposed to do. So the team wasn't built in a way that was able to support this case and do the right thing. There's no excusing that action, and I'm not even going to begin to try to do that.
No, and in fact, that is your responsibility now, to implement these reforms and to try to make sure that this kind of thing never happens. I know that this did not happen on your watch, so to speak. You've only been in the position for several weeks. It is a huge challenge for you and for all individuals who work in Child Protective Services to make sure that these kids don't fall through the cracks.
Absolutely. I mean, there's no more difficult job, and I've never been a frontline caseworker, so I can't speak from personal experience, just from learning from the staff what they do on an everyday basis. And, you know, they go into places that you or I would never want to go into and see things that you and I never want to even think about. And they do it at the dark of night. They come whenever they need to come. What we're trying to focus on at DHS is addressing all of the recommendations, addressing all the wrongs that occurred on this case, and really ensuring that this never happens again.